Thank you very much there, Chris. It's always good on an afternoon to have someone who lightens it up with a little bit of humour. Right, we are behind time, but we are still on track for a few questions before we have a Q&A session. Has anyone got any questions they want to quickly ask?
We talk about big data, but how big does the data have to be to be relevant? So, for instance, I'm doing work in Lancashire, which is 1.2 million. That doesn't sound big enough to draw lots of some of the conclusions that Chris and others were talking about.
Yeah.
Liverpool, is that big enough, or are we talking about we have to encompass the northwest, or is there a floor? Is 100,000 big enough for certain things?
I think it's a misnomer that you must just have the biggest data set possible. It depends on what you're looking at. So it could be that you're looking at a much smaller data set for a very localised condition. But when we come to one of the slides there, which is what is the question that you don't know yet to ask, well, actually sometimes the bigger data sets can help to identify what the trends are, because you're looking outside of your very focused world to things that you wouldn't normally look at, and trends will come in that you didn't know existed. And those are the things where you might say, well, actually the bigger data sets are much better. But then researchers will say, I don't know, 7 to 10 million as a population size is really what we need to be gaining. And in fact, that's one of the things that Karen's just disappeared, but but Chris can jump in and answer for Karen.
So it's not a big, if you think of it, it's a terrible term, yeah? I'd like to ban the whole thing, yeah? So a lot of times it's not a big data, it's an analytics issue. Yeah. Sometimes it's what we call an information commons issue, which the data isn't big, there's just lots of different types. I mean, you get into the technical of it, there's different types of, and that's the issue. So don't just necessarily think huge. Yes, there will be with genomics data, it does become a scale issue on some things, but there's loads of different issues you're challenging. It's just got this massive thing called I'm sick kind of thing. You go to the doctor, it's not that. There's a number of different ways, and different people have different challenges in there.
But just to follow on, just with a supplementary in a sense, how big does it have to be for it to be able to create wealth? So from the other side of it, pharmaceutical companies or whatever it happens to be, is there a size where companies are saying, well, you've only got 1 million people, it's just not worth our bother, or we can't generate anything from that?
No. So imagine if you were, one of the things we're working on, imagine if you've got a disease registry for one of your diseases, just say diabetics, yeah? And you've mapped the genome, and it might only be a few of them. The speed you could select that cohort at for some candidates would be really quick to what they do at the moment. The data set isn't that big, but you're offering them a different service. So don't think the data set always has to be big. Think about the service you're offering at the end, and whether you're solving a real problem for them, yeah? Because if you've got a rare disease, sometimes the data set's never going to be big. It's the ability to have the span and be able to look at it. So different.
Mike?
I think perhaps relevant to that, I don't know if the other people agree with this, but my observation has been that when people talk about big data, they mean at least 3 different things, and you may actually be able to suggest others, but the 3 things that I've noticed is people talk about big data as the connection of lots of individual structured databases. And in a sense, that's really not big data at all, that's just small data. But it's the problem of data semantics, really being able to map data that is actually the same but calls something different in different systems together. But certainly people do use that term, and that's clearly very relevant to healthcare because that's one of our big problems. People then talk about, they apply the term big data to the analysis of often what are actually quite simple but very large data sets. And the Large Hadron Collider data problem is an example of that. And the third thing that they talk about is the analysis of non-structured data and going through the entire global mass of Twitter feeds and trying to extract some kind of meaning from it is an example of that. Now, people may suggest other things, but I've certainly heard people talk about at least those 3 things when they're talking about big data. They're different things, they address different problems, And I think it's important to recognise that, because people often talk about this as if big data is one thing, and it's definitely not one thing, it's at least three things.
No, it's not. You're absolutely right, and people do get confused about what we mean by big data. And I agree with Chris, the term big data really doesn't help at all, because within the NHS we've had large data sets for as long as I can remember. You know, HES, one of the largest data sets around on patient level data, which Dr. Foster lovingly uses and has made a living on. But actually, as you said, that's a simple data set. It's structured data. You know, anyone can analyse it. You know, that isn't big data. When we're talking about big data, depending on the use case around it, it will differ. But for me, big data is about how we analyse and use that data in terms of health, creating this wellness model, which is looking at all the different types of data, being able to take value from the different types of data and bring them together for the benefit of the patient in terms of their treatment, or predicting what care they will need in the future, for changing the provision of services around Merseyside and beyond, in terms of redesigning the whole of healthcare as we know it by looking at what we need to provide, not what we provided last year and then let's look in 10 years to did it make a difference, but actually let's be proactive in it.
There's another interesting one coming along which you should be aware of, because you'll think of it as mHealth and everyone else will talk about it as fast data, because we've only just cracked the problem of taking all the data off the net itself. What you didn't know, up until last year, most of the telcos threw most of the data away as it came into the system because they weren't able to capture it. So once you start getting to mHealth and the data starts coming in fast, that's when you get this collision of fast meets big, and you're going to get new terms around fast data. But you'll think of that as mHealth, and how you're getting, or machine-to-machine data, how you're getting machines, you know, your heart monitor or your whatever, glucometer machine, whatever you call them, yeah, is sending straight into something else. So now you've got another issue because you've got the speed coming in. Now we only technically cracked that because the Hydron's an interesting one, because the Hydron can throw away most of their data, yeah, which is really interesting. Most people don't know that, and they're only just looking at some of the big data techniques now to actually keep some of their